A very good morning to all. Our patients don't care how much we know until they know how much we care. Due to our hectic schedules, we tend to spend less time with our patients. Hence, they are left with inadequate or half knowledge about their illness and treatment. Respected judges, chairpersons, and my dear colleagues, today I'll be presenting an innovative way of providing health education to our patients. The actual patient education video starts from now. The topic I've chosen today as an example is chronic otitis media.
Hi, do you have ear discharge, ear pain, hard of hearing, bloodstain discharge, or foul smelling discharge?
The problem you might have is a hole in your eardrum due to chronic infection of your middle ear. This condition in medical terms is known as chronic otitis media.
There could be several reasons for the cause of this perforation. It could either be because of recurrent infections in childhood which were not treated adequately, recurrent middle ear infections, which is known as acute otitis media, direct trauma to the eardrum, or because of chronic nasal or upper respiratory tract infections, smoking, or because of eustachian tube dysfunction. This is a tube that connects your ear and the region behind your ear.
In order to inspect your eardrum, the doctor will use an otoscope through which he can see your perforated eardrum.
What's the solution to this problem? If there's discharge, your doctor will be cleaning your ears either by using a suction or by dry mopping. You'll be given ear drops that need to be instilled into your ears, and you'll also be put on a course of oral medication. There are few preventive measures that need to be taken. Plug in your ears with cotton while taking head bath or while swimming. If there's any pre-existing sinus infection that needs to be treated. If there's any other source of infection that is knee tonsils or adenoids, even they need to be treated.
Once the discharge subsides, a pure tone audiometry test needs to be done to assess your hearing loss. If left untreated, this infection can spread to the bone behind your ear, which is known as mastoiditis. It can damage your facial nerve, causing facial paralysis. It can spread to your inner ear, causing symptoms such as vertigo and can worsen your hearing. This infection can also gradually spread to your brain, which is life-threatening.
Before deciding on a definitive treatment, first we need to eradicate the cause for infection. If deviated nasal septum is the cause for recurrent infections, septoplasty needs to be done. If the foci of infection is in the adenoids or tonsil, adenotonsillectomy needs to be done. After we rule out the above causes, we can then plan for tympanoplasty, which is a procedure done to close the perforation and to restore your hearing.
In our center, the surgery is done under local anesthesia. As you can see, initially we start off by giving injections of local anesthetic. You'll be conscious throughout the surgery, but you won't experience any pain. Next, an incision is made right behind the ear, the scar of which cannot be seen at all. This is the graft that is being harvested, which is used to repair your eardrum. This is how your eardrum looks with the perforation. The bone behind the ear, which is called the mastoid, will be drilled to remove all the infected air cells. Once that is done, the graft will be placed, and this is how your repaired tympanic membrane looks. Next, gel foam is used, which is soaked in antibiotic drops, which is filled in the middle ear and external ear. And finally, the wound is sutured. This is how your eardrum will look 6 months after surgery.
Complications such as bleeding, facial nerve injury, wound infection, chorotympani nerve injury, tympanoplasty failure, sensorineural hearing loss or dizziness are known to occur. But however, such complications are very rare in the hands of an expert surgeon. You will have to visit us on post-op day 3 for dressing change, post-op day 10 for suture removal, and post-op day 15 for canal pack removal. Post-operative instructions. Avoid head bath until post-op day 15, after which you need to plug in your ear with cottons and have head bath for at least 3 months. Avoid all cold beverages for at least 3 months because any nasal or throat infection can easily spread to the ears. Avoid blowing your nose until the doctor tells you that your eardrum is completely healed.
The advantages of this video are it's less time consuming, and without spending much of our time, we're still able to educate our patients. It's more personalized as we are speaking to our patients directly through the video. The quality in our service is not what we put into, it is what our patients get out of it. Thank you.